Hello friends, today we all have gathered here to make a discussion on the topic diabetes. Starting off with, what is diabetes? A chronic systematic disease characterized by the disorder of carbohydrate, protein and fat metabolism, characterized by hyperglycemia due to an absolute or relative lack of insulin, or to a cellular resistance to insulin. There are two types of diabetes, type 1 diabetes and type 2 diabetes.
Type 1 diabetes. When you are affected with type 1 diabetes, your pancreas does not produce insulin. This type accounts for 5 to 10% of people with diabetes. Causes for this type of diabetes are genetic factors, immunological factors, and environmental factor. Type 2 diabetes. It occurs when the body does not produce enough insulin or when the cells are unable to use insulin properly, which is called insulin resistance. 90 to 95% of people suffering from diabetes have this type. In recent years, type 2 diabetes has been diagnosed in the younger people too, including children, more frequently than in the past. Causes for type 2 diabetes are high blood pressure, smoking, overweight, etc. How does diabetes affect our body? Over time, high blood sugar levels can lead to kidney disease, heart disease, and blindness. The excess sugar in the bloodstream can damage the tiny blood vessels in our eyes and kidneys and can harden or narrow our arteries. Some symptoms for diabetes are extreme thirst, frequent urination, blurry vision, etc. These are some more symptoms for diabetes. Now let us know some management tips for diabetes. The main management or goal is to normalize insulin activity and blood glucose level to reduce the vascular and nephropathic complications. 5 main components for management of diabetes mellitus patients are diet, exercise, monitoring, education, and medication. Prevention of type 2 diabetes mellitus. Guidelines for prevention of diabetes are weight reduction, proper nutrition, regular physical activity, cardiovascular risk factor reduction, aggressive treatment of hypertension and dyslipidemia. Blood glucose screening at 3 years intervals starting at age of 45 for person in high risk group. In this video, we examined the two most common types of diabetes, type 1 and type 2, and we also examined some of the basic causes for these type of diabetes. In conclusion, I hope that I have given you a better understanding of a disease that can be fatal and the procedures required by the people suffering from diabetes to avoid disabilities or death.